Hello, everybody. I'm very happy to talk with Dr. Kavita today with a super subject, which is Ayurveda. So we discover a bit. Dr. Kavita is placed in, how do you call your island?
Mauritius.
Mauritius. I have to think in, normally I speak in French, so I have to think in, adjust in English. So in Mauritius, and you're specialized in Ayurveda. You work with patients in a clinic, no?
Yes, in a hospital,
In a
Ayurvedic clinic.
hospital even. Which means for us Europeans that Ayurveda can treat everything, no?
Yes. It can treat chronic disorders and definitely not the emergency disorders.
Not emergency, but for
Emergency.
example, infections and
Yes, infections, we deal with infections and to improve immune system basically. And just sort of if a patient is having cardiac attack, for the emergency services, we don't take
yeah,
really.
of course, because it's not, Ayurveda is not something which acts as on the effect, but more on the cause. So the patient is
Yes.
healthy. It looks for the
Yeah.
general health and continuous health, not
Okay.
when we cannot leave anymore, we go to the hospital. We
Yeah.
go before in the first symptoms. So just to have an idea of Ayurveda, you studied that for many years.
Yeah. It's same like 5.5 year of BAMS, Bachelor of Ayurvedic Medicines and Surgery. And then you have post-graduation also, again for 2 years. So 3 years actually, 2 years is diploma and 3 years is post-graduation degree. So it's same like an allopathic medicine practitioner course.
So 8 years, minimum
Yes,
minimum of 8 years.
minimum.
And Ayurveda is an ancient Indian medicine which which treats with plants. So it's a natural treatment.
Definitely. It's actually 5,000 years old Indian system of traditional medicine. And it's basically works on the principle of nature. Just like whatever is derived from nature that we use here in the form of medicines, basically. And just like if you know that our universe is made up of Panchamahabhut, these five elements,
Mm.
just like space, air, fire, water, and earth. In our body also, these five elements we have in form of three basic principles. That is, maybe if you have heard about it, Vat, Pith, and Kaph.
Yeah, we
You
call
are
it
aware
Vata,
about.
Pitta, and Kapha.
Yes,
so,
it's the same.
so,
Vata, Pitta, and
yeah,
Kapha.
which is water, fire, and
Yeah.
air.
So actually what happens, there are two combinations. Suppose we talk about Vata, it is made up of space and air. If we talk about Pitta, it is made up of fire and water. And when we talk about Kapha, it is made up of the content water and earth.
Hmm.
So when you see there are some changes in weather conditions, some maybe some changed in seasons. So same changes happens in our body also that we can feel. So that's why there are some dietary regimes, dietary precautions that we need to take as per season.
Hmm.
Like in winter, the course and diet will be different. In summer, it will be different. So it's all depends upon whatever changes happening in the universe, it's happening inside our body also.
And when you have a patient, for example, you understand what type of person it is, Vata,
Yes.
Kapha.
Yeah, definitely. Actually, just like you talk about the DNA composition, genetic composition, same way Ayurveda deals with the Prakriti, the body constitution of a person.
Hmm.
All these types of doshas, which means all of us have maybe having one predominant factor, dosha, it could be vata. And basically, it's like dual constitution. Maybe someone is vata pitta, someone is pitta kapha, and someone is kapha vata. So the diseases also, if these factors, actually before explaining to about the body constitution, if these factors are in balanced form, because we all of us are going to have all these three factors, but only two will be predominant, and that is going to conclude the body constitution of that person. Okay. Yeah, if these are in balance, it's working balance, which means Vata is responsible for basically the movements, motion, because it's made up of air and space.
Mm.
So whatever neurological activity is happening in our body, that Vata is responsible for all these activities, from excretion of stool to blinking of eyes, all types of nervous system activities, everything.
Mm.
Pitta is responsible for all types of digestion, metabolism, okay, the chemical changes happening in our body. It could be the production, the conversion of nutrients also, that is giving nutrition to our body. Okay, assimilation. So that pitta factor is responsible. And kapha factor is responsible for all types of secretions, just like synovial fluid, we have all types of lubrications, we have some mucus collection, which is in a healthy way, water content in our body, that kapha factor is responsible. So if this is working in combination, in synchronization, we are healthy. And if it is one factor is so high, just like in a Parkinson's patient, vata factor is excessively high, so that's why the patients are having tremors. So then we have to balance vata factor, vata pacifying medicines we have to give. Same way, a patient of bronchial asthma, the kapha is very high, so we have to balance that kapha factor. Okay, so you will see directly a patient of hyperacidity, pitta is very high, excessively high, than having acid like symptoms, because all these doshas, they have their own symptoms also, which are natural. Okay, it's good to have kapha, it's good to have pitta, then we are going to have our gastric fire. But then we are diseased because these are excessively high or very low in amount. Then when we, as an ayurvedic practitioner, we balance these doshas.
And these are in relation also with our emotions. Somebody
Yes,
who has
definitely.
you deal with that also.
Definitely, health as per Ayurveda, it's not merely the absence of diseases, it's actually the well being of physical, mental, social, spiritual, emotional, intellectual, even financial, or your occupational health. So, everywhere, if a person is well enough, having well being, then that is considered as health.
Mm.
So, if a person is like emotionally sick, it's going to increase its vata content in the body, and then patient will have insomnia or some kind of other anxiety disorders. Understand? So we have to consider, when a patient is coming, first we have to consider the doshic constitution, the body constitution of the patient, and then we have to consider which factor is high, then what we are going to balance. If we talk about disease, actually, as per Ayurveda, because today our topic was detoxification, so first I would like to explain all your viewers that exactly what toxins means as per Ayurveda. Because toxin, it's not like a poison we have taken from outside. This is something which is produced within our body, and due to our own wrong food and diet and lifestyle, all these habits, what happen when we are indulged in some wrong diet and lifestyle, or a sedentary lifestyle, or exposed to some radiations, or some kind of you can say pesticides exposure, or we are ingesting in our diet, then these doshas that I have just talked about, these gets imbalanced, maybe high or maybe low, which have a direct impact on our gastric fire. Our gastric fire is extremely important for our health. If that is working properly, we are healthy. If that is not working properly, which means the food is not digested properly, there will be partial digestion of food, or there will be indigestion. Whenever there is byproduct left, where there is partial digestion of food, that gives a rus which is known as ama. Ama is a toxin, this we call as toxin. When it keeps on accumulating and accumulating over a period of time, then it starts getting absorbed to the deeper tissues, deeper cells in our body, even in organs. Which means, you know what happened, suppose a patient of rheumatoid arthritis, maybe patient's rheumatoid factor is positive today, but it is not like today he has got rheumatoid arthritis. Maybe since decade the toxin was accumulating in the body, and it has reached to the all the joints and tissues, and then it starts manifesting in terms of redness and swelling and some joint stiffness in the morning. Okay,
And
so
this
these
is
all
caused by toxins.
toxins, yes,
Hmm.
because you know these toxins, they circulate in our body in a search of what? In search of the weakest area, weakest organ, weakest cell or structure. It could be anything. And when, because this is actually, it is unwanted for our body tries to remove it. Our body is going to give the some signals that we have to recognize, or an Ayurvedic, if you reach on time to an Ayurvedic doctor, definitely they are going to do something to remove those toxins in the first or second stage only. But if a patient has not yet reached, they have accumulated in the deeper tissues, then it is difficult. Then you have to go for the real panchakarma, that detoxification, because you have to purify or biopurification of that body.
But
Understand?
if the doctor understands that before, he will do what? He will give you a detoxification anyway, no?
Yes, you know, in fact, you know, not only diseased people, a healthy individual also can do detoxification panchakarma for the fitness, for immunity boosting effect, or for the cell rejuvenation effect.
Mm.
If you want me to explain Panchakarma in detail,
Yeah.
detoxification procedure in detail, okay. So basically, we have three types of Panchakarma, means five karmas. We have five basic procedures that we do to remove toxins from the body. First is Vaman, that is known as therapeutic emesis, which means induced vomiting, removing toxins through the oral route. Second is purgation. Purgation is virechana. It's therapeutic purgation, which means removing toxins through the anal route. Third is vasti. Vasti, as you know, enemas, maybe you have heard about it. Okay, but these are medicated enemas. These are kind of, we use decoctions of medicines. We use some oil enemas to detoxify also and to rejuvenate also. And the fifth one is
But
nasya.
this one,
Nasya,
sorry, this one is by massage or we
I will
drink
explain you.
them? Okay.
I'll explain you. Massage is one part actually to bring those toxins to the GIT, your gastrointestinal tract. The last one I was talking about, Nasya. This is nasal administration of medicine for all these ENT disorders, because it will goes through the sinuses, and then the medicine is going to work over the head part area, ENT disorders. So first, pre-operative, we have to divide it in three parts, that is pre-operative procedures, operative procedures, and the post-operative procedures. In pre-procedures, we plan the treatment, which means we have to prepare the patient, prepare the body, so that this toxin is going to come out. Because you know, this ama toxin, it has a sticky quality, sticky in nature. It's get adhered very deeply to the tissues. You can't just remove it. Okay, it's everywhere in your body. You can't just remove it. So what you have to do, first you have to prepare the patient, improve the digestive power of that patient. Definitely the patient's gastric fire is weak. We have to give for 1 week or some 2 weeks, or depends how much is the gastric fire has affected. We have to give some digestive stimulant medicines first. Okay, which means improving the gastric fire, the digestion. You can understand like this. We give digestive stimulants. Okay, then we give patient, depend which type of panchkarma detox we have planned for that patient. Suppose we have planned Vaman and Virechan. Two, I'm explaining you first. Suppose we have planned through the therapeutic vomiting and therapeutic purgation through the down route.
Yes.
Okay. Then we have to give patients some oil medicated ghee. You can understand like medicated oils and medicated clarified butter, like Trifla
To
Grad or
drink
Mahatik.
or to drink,
Yes,
no?
yes.
Mm.
To drink, yes. So then what ghee has a quality, that fat content, it has a quality that it goes inside, it absorbs well, and it gets adhere to that lodged toxin inside. So that is given depending upon patients, again, constitution, patient's health, patient's disease condition, everything. It could be up to 3 days, up to 7 days. Minimum 3 days, maximum 7 days. Start with 30 ml, then 60 ml, increasing manner. We give that ghee formulation to the patient to drink oral in the morning, empty stomach. And that is then those days definitely the diet will be different, that we explain to the patient. And then when the ghee course is finished orally, then we call the patient actually for the massage. Actually, massage is just a help for Panchakarma detoxification. It is not actual Panchakarma detoxification. First, we have oilated the patient from inside by giving ghee administration. Now we have to oilate the patient from outside. Understand, these toxins, we give some movements, basic movements, bring it to the GIT, the gastrointestinal tract. Suppose if in a patient kapha has increased, there is a toxin of kapha, then it will come to stomach. We have to remove it through the oral route. And if pitta has increased, then it will come to the colon, the intestine part, and it will go through the down route, anal route, which means we will plan purgation, virechana. So we will call the patient 3 days for continuous massage and sudation. Sudation is whole body steam bath, you can understand.
Yeah.
Because when our body will come in contact with heat, this toxin along with ghee, it's going to melt down. Okay. And then when ghee will travel, which means along with those toxins, it will travel to the GIT, to the hollow structure of your body. Okay. Then when 3 days of this procedure is complete, okay, then the last day we are going to plan, that is the main actually detox day. We are going to give the patient only one dose of medicine. If we have given for the vomiting medicines, therapeutic vomiting, then patient will go for the evacuation through the oral route. You will see kapha, it has come. You will see that white part, mucus, and all these type of things, it is coming. And when we have planned through the down route, then the patient will go for motions. It could be 8 times, it could be 16 times. It's like 1 day procedure. Okay. And when that day main procedure is done, now patient is very soft, his or her gastric fire is very low. Then post-operative procedure comes. Patient has to be on a special diet. Slowly, we are going to increase the diet from liquid to semi-solid, then solid. It will take again 1 week to maybe 2 weeks, so that the patient is going to come on the normal diet regime. And after, when everything, all these 3 steps are complete, patient is completely clean, detoxified. Now we are going to administer the medicine course, basically, because it's clean now, cells are new now. Now you will give rejuvenating medicines. That will continue. It could be for months, or could be OPD time, OPD basis. Here, this is only, two I have explained. If we talk about Vasti is not that much complicated. In Vasti, you don't need to take ghee administration.
What is Vasti again, please?
Oh, sorry. Vasti is medicated enemas that I was talking about.
Yeah.
Now, actually, for me, Vasti is more fascinating. Why? Because it's the half treatment of all types of disorders, all whatever you can understand. Maximum just 95%, 5% definitely there are some other complications that we don't administer Vasti. What happened in Vasti, in medicated enemas, first is asthapan Vasti, that is known as the enema is going to contain maybe 1 liter of medicine in decoction form. There will be some other medicated ghee also, oils also, honey also, and some pink salt, sendha namak actually we say, sendha salt, and some powders that is going to cause the colonic distension when we administer through the anal route. The patient is going to hold it for some time, and then he's going to go evacuate immediately after the holding period. it will bring all, definitely the fecal matter, it will come out, but at the same time it is going to bring out all types of fat soluble toxins. Water soluble toxins, it comes out daily basis, like with from our stool, urine, sweat. But the problem here, we are talking about the fat soluble toxins, which are rigid actually, which causes actually all the problems. Okay, so this vasti content, that composition so much, that in Ayurveda there are more than 3000 types of enemas are mentioned as per disease. So the formulation will be
3000
different.
decoction.
Yes, it's not only decoction, it's not just water enema. You have heard about the enemas just before delivery or operation, or just to avoid constipation, remove constipation. But it's not only water or soap solution enema. If we are talking about the medicated enema, the formulation is as per body constitution, as per the diseased condition, as per our motive,
So it can
what
be
we are
pills
planning.
also.
No, no, it is not pills. It's only through the liquid form that we have to administer through the anal route. Then patient is going
Oh.
to hold for some time and then go for evacuation in the toilet. And then they are going to remove, along with fecal matter, all types of toxins. Because why? It's going to, how you can understand a vasti anima is going to be helpful in Parkinson's, or in sciatic problem, or in neurological problem, hemiparesis, paralysis, all these types of problems. How? Because it's going to, just like we have our nervous system, we have our nervous system in our gut also, in our intestine also, in our whole actually gastrointestinal tract. Okay, so when we administer this solution, actually, the composition, the medicine, the potency of that medicine, it starts acting over that nerves, weakest nerve. It stimulates the nervous system, parasympathetic nervous system. It stimulates actually all types of nerves in your body. And then that's how these organs, all the organs gets a stimulus, a triggering factor, and it starts evacuating those types of toxins, from which means it's the same like a hyperosmotic solution. So it acts like it releases all the toxins through the colonic mucosa, and then it comes out. But now you can't just detoxify the patient next day. There is a actually course of this enemas treatment. It's not like you give only one. You can give one if a patient just want normal purificatory effect. But if you want a complete detox, then first you have to, one day you need to give detox vasti, second day you need to give rejuvenating enema, which means that is just in a form of oil containing some other formulations. So that oil is very minimum dose. It's not 1 liter, it's just maybe 60 ml or 120 ml, depending upon what type we are planning. So that we give for rejuvenation. Patient is going to hold for long time. It could be more than 1 hour, it could be 2 hours. Okay, then patient slowly is going to release that oil, that medicated oil. Okay,
You mean to drink it?
no, that is also through anal route.
Okay, so
Yes,
somebody needs to
that's,
be to come to you, and it's like
yes,
you're
definitely.
inside, you're treated.
We
You
have
cannot
to
do that at
follow the
home.
patient. Yeah, we have, no, we have to follow that patient. We have to, the doctor has to prepare the seeing the patient, that formulation. Okay, today I have detoxified the patient, the next day I have to rejuvenate that patient, otherwise there will be dryness in that colonic mucosa. So you can't just giving the drying treatment, you have to rejuvenate also at the same time. Then it keeps on up to 8 sessions, up to 15 sessions, up to 30 sessions, depending upon the condition of the patient. Okay, the stamina of the patient, or the category, the body constitution of the patient, we have to plan accordingly. Okay, so this is the medicated enema phase. Whatever toxins that we are talking about, these toxins you cannot remove just by drinking juice. Just like nowadays there is a craze that you drink aloe vera juice, or you drink
Yeah.
some alkaline water, you are going to be detoxified completely. Yes, to some extent it will work. But when we talk about the disease causing toxins inside our body, that panchkarma is meant for. Panchkarma has to be adopted. detox
And
for the biopurification.
we do that once and it's enough, or we need to do it every year?
Suppose for fitness, if a person is doing for health benefits, a person is doing, then every year once they can do, not a problem. But if a patient is having disease condition, that we have to see. It could be even in 6 months, or it could be maybe once in a year, depending, because for a diseased patient, the panchakarma will go for quite long. Maybe we have to follow many procedures. And for a diseased fitness, it could be just maybe only vasti we have planned. We have to see the constitution, which factor is high. If suppose you are pitta in nature, and your pitta is high, basically you are having some skin issues, or any kind of hormonal issues, suppose, then we have to balance pitta, then only virejan is sufficient, purgation is sufficient. But if we see at the same time vata factor is also associated, we can see some dryness in the body, or some joints pain, arthritic joints pain in the body, or some kind of sleeplessness, or graying of hair, or hair fall we are seeing. So we have to see the factors. So if that is also involved, then I will add detox through the vasti and medicated enemas as well. Understand? So
Yeah,
that
but
is
it's
basically
very
totally,
complicated for us. You
you know,
studied a lot to
yeah,
understand all these factors, but
yeah.
it's
Actually, that's why Ayurveda is known as tailored cut. It's a designer's medicine. It's not like one remedy for all. For each and every patient, formulation and the plan of that treatment detox will be different.
Mm.
It can't be just designers, okay, you also take that, you also take that.
But somebody in Europe normally couldn't do this detox. We need to come to
Uh,
Mauritius.
you can, yes, you can come to Mauritius, or unless until if I come there, or some other Ayurvedic doctor goes there, then they can do, definitely.
But even if you come here, you need all the detox and all the...
Yes, you need to have some facility, and definitely, because some medicines you need to have. Then that doctor can bring the medicines with them, and you need to have the formulation. You need, because the medicines that we prepare, it has to be on the same day. It's not like you prepare and keep it. So
Yeah.
after seeing the patient, the condition, then you prepare, and then you have to give to the patient.
And for example, what is some spectacular examples you could give of patient that got healthy of a chronic disease? Like,
Oh, that is, you just name it. It could be rheumatoid arthritis, it could be osteoarthritis, even skin conditions like psoriasis and vitiligo, leukoderma, all types of skin disorders. This Panchakarma is beneficial. Just like I told you, neurological disorders, even in Parkinson's and
even
sciatic
Parkinson's
pain,
can be treated.
can be, yes, it can be controlled. Patient won't be needing dopamines or sort of medicines each every 3 4 hours usually they take. So they won't be needing that, because this is going to, vasti is the best treatment for the all these Parkinson's disorders, because then we have to rejuvenate, giving rejuvenating vastis also, enemas also. So patients getting the stimulus, brain is getting the stimulus, and then there won't be any problem, that they can be fine for maybe long period of time. Then if in case they are started again, maybe with a low dose of medicine they will take side by side, or they can take the treatment again. That depends how, which stage the disease has gone.
And for example, the neurological diseases like myasthenia or all that can be treated.
Yes, in Ayurveda, there are some terms like incurable diseases.
Mm.
Suppose if a patient is having cancer, or a patient is having myasthenia gravis, or a patient is having some spondylosis, where surgical treatment is required, this cannot be treated with panchkarma. That's why we have to see the patient first, which types of disease we can treat. In some, it's why I'm saying rheumatoid arthritis, if there is joint deformity, that cannot be corrected, because that is surgical now. Where we can help, The patient's rheumatoid factor, Ra factor is positive, CRP is positive, it's high, but no joint deformity. But patient is having like joint stiffness, having redness. The symptoms has already started. If complications has arrived, then nothing can be done.
Yeah.
Suppose in chronic kidney disorders, if patient has reached for dialysis, then we can't do anything. But if the urea and creatinine level just started increasing, first stage or second stage of kidney disorders, that we can treat.
Yeah. So that's very interesting. The only thing is that people should come to Mauritius, so they are treated, but for some weeks. Then I understand
Yes, for some
minimum
weeks. Yeah.
2 weeks.
Minimum, it could be, yeah, minimum 2 weeks. Yes, definitely. And if someone is coming just for fitness, even 1 week treatment also will be beneficial. But for a disease patient, yes, minimum 2 weeks. You
And
know how you are going to understand that which patient we are going to treat completely. That's why we say that Ayurveda uproots the disease. It works over the root cause of the disease. That root cause actually is the toxin. Just like in modern science, we have two stages of disease, just the symptoms and complications. Same way, Ayurveda, we have six stages of disease progression. First is, if I explain you, then you will have a clear idea that which stage if we are, and we are going to reverse that disease. Understand? Just I explained you how toxins are forming in your body. First stage is stage of accumulation. If you are aware at this stage when the toxins just started accumulating only in your stomach, only in your GIT, you don't need any panchkarma, you don't need any detox. You can do it yourself at home by just normal simple fasting or some taking digestive stimulant medicine. Okay, because this is just the first stage of toxin accumulation. It has not gone from your channels to your tissues.
but
Now
I think
second stage,
this
yeah,
is everybody who has it.
yeah,
Everybody should have
everybody.
the first case.
Yeah, definitely. Somewhere it has to start somewhere.
So from time to time, it would be good for everybody to do fasting.
Definitely. Yeah, that's why we say if we do fasting in between intermittent fasting or just for a few hours, 16 hours, 15 hours, especially in the night time, we take early dinner and then we take late. Whatever toxins are accumulated in the body, in stomach only, our own gastric fire is going to ignite and then digest it,
Yeah.
and it will come out.
We
It
need to
won't
give
go in the
time.
circulation. Yeah, it won't go in. Then just you have to drink some warm water or some ginger infusion, depending upon if it suits you. Some can take some fresh juice, also can take. But depend which type of toxin is started to form, then you can definitely remove it. But
Or
second
lemon,
stage,
we take lemon and ginger many times, no?
yeah, that is very good. You can take just lemon juice also, or you can mix some honey in that. If it's you have pure honey there, and ginger infusion. Ginger is best remedy for all types of gastric disorders because it is digestive stimulating in nature. It is vata decreasing, pacifying also, kapha decreasing also at the same time. It improves your gastric fire. So whatever toxins are forming, it's going to digest that toxin. Understand? Because two
Interesting.
things we have to do. Yeah, two things we have to do. First, we have to correct our diet and lifestyle, because if you keep on indulging in fast food or having some wrong lifestyle, late night awake, you are not sleeping on time, eating on time, heavy carbohydrate meals if a patient is taking, then in that case the toxin level, it's keep accumulating. It will go to second stage, which is stage of aggravation. On the same place the glass is start to fill now. Earlier glass was just filling, now glass is start to fill, and it's filling up to top. So now this is aggravating in the same place, in the stomach only. Here also, if you don't take, your body is giving chances. The next day you will have nausea, you feel like acidity, something is not good, you don't like to eat. But if you eat again next day, then which means what? Toxins are again forming, it's digested, or you take some antacid, suppose omeprazole or pantoprazole if you are taking. So just you are masking the symptoms, but the problem is still here. So this first stage, that toxin, it starts in absorbing from your mucosa now. Then it will go to your channels, your circulation, which is in the third stage of migration. Now it starts to travel through your, your all your channels. They are going to transport all the nutrients from your stomach, okay, through your circulation. You can understand it like through circulation. Okay. Now at the same time, now here nutrients are not formed but toxins are formed. This is also going to be transported to your inner cells. Understand?
Yeah.
Now if we keep doing, if here also, if here panchkarma starts, actually first and second stage, no need of panchkarma detoxification, just normal diet precautions you can take, it's going to be fine. Third stage, you need panchkarma because it started traveling now. Easily you can bring it down. Easily you can, if you take one suppose one vasti, you can easily control it, or even purgation also can be planned. Easily it will come down again to the GIT and you remove it. Understand? But now if again you have not done anything, again you are indulged in wrong food and diet and lifestyle, same way, the keep increasing, again forming, keep increasing. Now it's going to be deposited, the stage of localization, because it will start seeing some wrong some weak tissues. Each cell, each body, just like we have our own immune system, our cells also have immunity. It could be low immunity, could be genetic predisposition. Suppose we take an example of a rheumatoid arthritis patient, RA patient, like in Creole we say here rheumatologists. So these patients, they are genetically predisposed. Maybe they are having some hereditary issues, mother or father was having. So they are genetically predisposed. If they indulge in some wrong diet and lifestyle, they are more predisposed to be having rheumatoid arthritis. Okay, so if these types of patients we target, we can reverse that process through detoxification. But if we are not, then definitely they are going to show someday RA positive factor. Okay, so these weak end area, suppose a patient is having an infertility, so their ovaries and uterus, that is the weakest organ. Suppose a patient is having uterine fibroid, so their uterus is the weakest area. The toxins has gone and accumulated and deposited in the uterus, or ovarian cystic form, polycystic ovarian syndrome that you have or in the ovaries, or a patient have hormonal problems in all types of the hormonal system. So if a patient is having diabetes, the pancreas is unhealthy. Okay, so the toxins will move towards the pancreas. Understand? Which means patient is having genetic predisposition which makes that organ unhealthy. He has not yet got diabetes, but that organ is still susceptible, or due to kapha, just like kapha. If I'm kapha, so I'm kapha actually, so I am predisposed to be having diabetes if I won't control, because all these kapha patients, they are susceptible to have diabetes, all types of obesity or puffiness, or kind of water retention, kidney disorders, even rheumatoid arthritis, RA also. So all these body constitution also we have to keep in mind, which patient, if little bit also high, then they are more susceptible for that problem. Huh? Some pitta problem, they are more susceptible to have melasma, acne, or all these kind of conditions. So this toxin also, he has a mind, it understand and it goes towards that area, okay, to be accumulated. In RA, usually in modern science, when the rheumatoid factor is positive or antibodies are formed, usually doctors say, in as per modern science, that there is no reason that why this happens. It is just autoimmune disorder. But Ayurveda has an answer for this. Actually, our body is making the antibodies against that toxin which has been adhering that our cells and tissues. It's not acting against our cells and tissues, but because it is there, so our cells and tissues also degenerated and deteriorated. It's affected. The cell functioning is altered. Understand?
Yeah,
So
the thing which is so interesting is that in our culture here, we don't talk much about toxins. Nobody is taking care of that. And Ayurveda is really focused on that because it understands the cause.
yes, definitely. Because I have seen many cases. Just I have seen one patient from France. His urea creatinine is already in second stage. Doctor, there is not giving any medicine. Okay, that is increasing, and they are waiting him so that when it's going to be very high, then they will start dialysis. If right now he will take precautions, he will take some purificatory procedures, detoxifying procedures, and after that he takes some kidney function toner medicine, we improve the glomerular filtration rate, and some rejuvenating kidney cells medicines like punarnava, gokshuru, that we have, it's going to be 100% stabilized, maybe for a decade, maybe for 10 years or 15 years we can save that patient from dialysis.
Yeah, a lot of diseases could be saved like this.
Definitely,
We need
definitely.
a clinic of Ayurveda here.
Oh, yes, definitely. It's actually in the whole world now. Ayurveda is gaining momentum nowadays.
Really.
It's very popular, traditional medicine,
Mm.
especially Ayurveda. It's
And
really
especially
popular.
when we arrive at 40 years old, like a certain age, then you should do a detox because things might be accumulating. Sure.
Definitely. We all are human being. So, you can't avoid pesticides here. You can't filter the air each time. You can purify water, but from everywhere, every point of time, it's coming to your body. It could be even sometimes our work culture is like this. Sometimes we have to be awake till late at night. We have to work. We have to sit whole day. It's not like
Yeah,
we
exactly.
can't
We
leave
don't
office
we
hours.
don't
We don't move
make a lot of
actually.
movement to
Definitely.
eliminate by
Our
perspiration.
rather improve the flexibility in our body.
Yeah.
So everybody, even everyone who is aware also, they are going to be accumulating toxins in their body. And time to time, definitely we have to do the detox, the biopurification.
Even the symptom that we feel we don't have enough energy, instead of taking a coffee to boost
Yeah.
ourselves all the time, all the system is busted, but we need if we have this symptom of not enough energy. What do you understand by that?
Not if enough energy. Ayurveda has a saptadhatu concept, which means our cells are gaining energy from the previous cell. I give you the series of cells. Suppose ras rakt masmed asthi majja shukra. This is Sanskrit terminology.
Mm,
Ras means your plasma, your lymph.
mm,
Rakt, blood. Then it comes to muscles, then adipose tissues, then bones, then bone marrow, and then your oj, which means your in females it's ovum, sperm, and your immune system. Okay, so our whatever food we eat, whatever disease we are getting, it's going to be affected in this series. Even if we are getting the medicine, if you are not having energy, which is the last, you can see on the last point of the series, last step, that is immune system and the energy nutrients. So this is because whole series is affected. Even your lymph is affected, your blood is affected, your muscles, adipose tissues, bones, bone marrows, everything is affected. Suppose a patient is having hair fall, we cannot directly rejuvenate hair without rejuvenating bones. We have to rejuvenate. That's why we give calcium. You can understand some mineral supplements we give for a hair fall patient. We
mm.
have to give iron supplements if the patient is anemic, because the blood, it's going to be nourished, then it's going to nourish the next cell.
But
Understand?
before giving the supplements, you need to do a detox anyway.
If you do detox and then you take supplement, it's 100% miracle you get. Which means, because if a house is completely clean and you are painting that house, it's clean, okay, you will get a different result. If a house is having dust everywhere and you are going to paint, then it will smell, and there will be garbage everywhere. So this is not going to be really beautiful.
Yeah. So really, we have to enter a bit in this culture of detox. I know you
Yeah.
have a break, and you were so kind to have this interview in your lunch break
Yeah.
in
No,
the
no, no.
clinic.
It's okay. It's
I
perfectly
cannot.
fine.
I don't
It's
want
really
to
a
keep you
pleasure.
anymore, but it was really interesting and also short, for us to understand it, and a lot of information. I hope
Yeah,
people are not so confused, but for sure, it's a whole science
definitely.
that we cannot expose it in 1 hour. But
Yeah.
it's very interesting, and I see you very passionate about it also.
We are just trying our job, trying to do it in a better way,
For sure.
just to serve people. Mm.
So thank you a lot for all this information.
Thank
And
you so much for having me.
yeah, I think we leave people with a lot of questions, but um, that's what else can we do? Go to Mauritius and have a detox, have
Yeah,
a
then I'm
retreat
here.
detox.
Definitely.
Yeah.
Then I'm here. If you want detox in Mauritius, definitely, then I will definitely can help. And if you, because in France to go, then there has to be, you can go, it's not a problem. Then just for one patient, it will be difficult to go there. If there are many patients, there is real demand there, then definitely I can think about it.
But you
Then we
need
can
all
come
the
there.
medicines, all the.
Then you need the for just for the detox, because it's time consuming. You need to have some setup, some basic setup, and basic staff, because we need some therapies also to do. And medicines wise, then we will have the basic medicines from which we are going to formulate medicines for each body constitution.
Yeah, yeah. Okay. So thanks a
Thank
lot.
you.
And
Thank
maybe
you.
we'll see you next time. Who knows?
Definitely, sure.
Thank you.